Hi, I'm Howard Spencer of Spencer Soul Food Plant-Based Eats and Treats, where we believe that the path to good health is by changing your environment so that the healthy choices can become the easy choices. And this applies whether in a small house, a neighborhood, a community, or a nation. Well, the results are in, at least the preliminary ones that is. Dr. Maria Clapperton, Director of the NCD unit of the Ministry of Health, laid some of the preliminary results of the 2024 STEP survey in a meeting with the Joint Select Committee of Social Services and Public Administration held on January 15, 2024. The meeting was an inquiry into the response of Trinidad and Tobago to its NCD epidemic. But what is a STEP survey? And what does the STEP survey even mean? Well, Dr. Roman Nagasa of the Ministry of Health will provide a little bit more information and explanation about the STEP survey and what is involved in such a survey.
So tell us, what is the STEP survey all about? What are we trying to achieve?
Right, so the STEP survey, it's an instrument, a questionnaire designed by the World Health Organization, Pan American Health Organization, for countries to determine their population's risk factors for non-communicable diseases such as diabetes, hypertension, heart disease, cancer, and stroke. So it's the country's ability to find out how the population's risk factors to develop these diseases are, and it's for us to use this information to monitor all the interventions that we have in place for health promotion campaigns and to determine how effective our healthcare system is and to improve the service out there for non-communicable diseases to prevent them and manage them properly.
Okay, so just to break it down, when you say the risk factors associated with non-communicable diseases, we're talking about finding out if people already know their cholesterol levels, if they know their blood pressure, or is it that during the survey that's all part of what is taken?
So that's part of what is taken. So it's called a STEP survey because it's a stepwise approach to surveillance, which is monitoring for risk factors for non-communicable diseses. So
and some of those risk factors are what?
Some of those risk factors would be those that are modifiable, such as tobacco, smoking, alcohol consumption, your diet, and then others would be biological, so blood pressure, your weight and height, your body mass index, and cholesterol, and blood glucose.
So as you can see, the STEP survey is really a survey which is done every so often to get a gauge of the health of the population and the risk factors which are present in the population so that the health authorities can project what can be the level of possible disease that can be occurring in the population in the near future and in not so near future. And this data is what Dr. Maria Clapperton reported to the Joint Select Committee on January the 15th. Now, I won't go through that video with you here because that clip, it has some length on it. So if you want to check that out for yourself, I'll put a link in the description box below so that you can check it out on your own time. However, what I will do is that I will go through the findings with you that was reported by Dr. Clapperton, and I will compare the data which was acquired in the 2024 survey and compare it to the 2011 survey and see what the trends are with regards to these risk factors. So to start, one of the risk factors which was looked at was tobacco consumption or smoking. In 2011, the amount or the percentage of people using tobacco was 21.1%. In 2024, the percentage of people using tobacco was 21.3%. So it hasn't changed a whole lot. So it's pretty much the same amount of or the same percentage of people using tobacco over the past 12 years. However, when it comes to tobacco, that is where we have seen a marked increase in the amount of people using or consuming alcohol. In 2011, the percentage of people using alcohol was 40.6%. In 2024, the percentage of people who are consuming alcohol within the past 30 days increased to 51.5%. That is over 10% increase in the amount or the percentage of people consuming alcohol. Inadequate fruit and vegetable intake, as in the amount or the percentage of the population who are not consuming the recommended amount of fruits and vegetables. In 2011, we had 91% of the population consuming less than 5 servings of fruits and vegetables a day, and in 2024, that percentage increased to 93.3%. So therefore, there hasn't been any improvement in the amount or the percentage of people who are consuming fruits and vegetables. And there is a reason why for that, and I will go into that in a future video. And that ties into that whole thing which I talk about the food environment and how the food environment influences health. That is one of the topics which I want to talk about with respect to how to change the food environment in order for people to become healthier. Fruit and vegetable intake, there are a lot of factors associated with why the fruit and vegetable intake the way it is, and I'll get into that at a later date. Now we're moving on to the biological risk factors. In 2011, the percentage of people who were being challenged with hypertension or what is known as high blood pressure was 26.3%. In 2024, that percentage increased to 29%. And this is not a surprise to me, because if you check my previous videos, I have delved into hypertension quite a bit. And based on my findings of hypertension and the government response, especially to this NCD, I am not surprised at the increase, because it all boils down to the food environment. The food environment influences a population's health. If the population's health is not improving, well, then there's something wrong with the food environment. If you check my previous videos, I say what is wrong with the food environment which causes people in Trinidad and Tobago to be so prone to hypertension. And if you want to, I can go into a deep dive into that, and I will show you what the solution is with regards to the population of Trinidad and Tobago reducing its proneness, for want of a better word, to getting hypertension. Now, this was a very big surprise to me. In 2011, the elevated fasting blood glucose was 20.5%, that is the percentage of people who had elevated fasting blood glucose. In 2024, that percentage decreased to 15.8%. So that is a small win for the population of Trinidad and Tobago, which was, as I said, it was a surprise to me, but it is a pleasant surprise. However, one of the things which I want to point out, which was not too big of a surprise, but it shows a worrying trend in the population, is the increase in the percentage of people who are having elevated cholesterol numbers. In 2011, the percentage of the population who were experiencing elevated cholesterol levels was 23.5%. In 2024, that percentage increased to 39.6%. So therefore, you could be looking at a 16% increase in the percentage of people who are experiencing elevated cholesterol numbers. And this ties into the number one killer in Trinidad and Tobago being heart disease. And if we are experiencing elevated cholesterol numbers, that explains a whole lot as to why, number one, heart disease is the number one killer in Trinidad and Tobago. And it could also explain why cardiologists are seeing younger and younger people being presented to the hospital with heart attacks. There was a doctor who said that his youngest patient that he dealt with was 22 years old, and he alluded to the people being presented to the hospital, some as young as in their 30s and early 40s, coming to the hospital with heart attacks. This type of situation was usually reserved for people who were of old age, so therefore people who were in their 80s, 70s, late 60s. These were the type of people in the past who were presented with heart attacks and elevated cholesterol. But now we're seeing a situation where younger and younger people are being presented to the hospital with heart attacks, and the percentage of people experiencing elevated cholesterol numbers can be a smoking gun as to what we are experiencing health-wise in the population in terms of heart disease and heart attacks. A big positive which we seem to have seen according to the data is that in this slide, have it wrong here. In 2011, the mean physical activity was 42.9 minutes. In 2024, the median physical activity was 102.9%. So my apologies for the slide having it wrong, but there was an increase in the amount of physical activity done between 2011 and 2024. However, in both instances between 2011 and 2024, it is below the World Health Organization recommendation of 150 minutes in a week. So yes, we are improving in terms of physical activity, which is something I am all on board for. But in terms of like improving the health of the population, improving physical activity is a step in the right direction, but it will not counteract the effects of a bad diet. Therefore, while we have seen an improvement in physical activity, we have to work on improving the quality of foods that we put into our mouth in order to see any positive change in the health of the population. Another positive change which we have seen in the data is that the amount of people who don't have any behavioral or biological risk factors have increased from 1% in 2011 to 1.6% in 2024. That's a very, very slight change, but as the saying goes, half a loaf is better than none. So that is an encouraging sign. And in 2011, the percentage of people who had 3 or more risk factors, either behavioral or biological, was 51.1%. In 2024, that percentage decreased to 38.4%, which is a good sign because it seems to indicate that there are more people in the population becoming health conscious. So if they check on their health and they seem to have any sort of risk factors, this will indicate that more and more people are taking steps to reduce their risk of either contracting, for want of a better word, a non-communicable disease, or if they have an NCD, they are trying to reduce the risk of any complications from such. However, what that will indicate now is that the amount or the percentage of the population who have 1 or 2 risk factors increased from 48% in 2011 to 60% in 2024. So this will indicate a 12% increase in the percentage of people who have 1 to 2 risk factors. So therefore, what that will indicate is that I have to have access to the full report so that I'll be able to make better conclusions. But this is a worrying sign, because what this means is that there seems to be an increase in the risk of people in the population either contracting an NCD or people who are exhibiting the behaviors that will contribute to NCD risk in the future. Now, here are some preliminary takeaways from the data that we have at this point in time. Based on the data, there was a very, very slight increase in smoking and tobacco use. And I believe one of the reasons why smoking and tobacco use, there has not been a significant increase in the amount of people who either smoke or use tobacco is because we have an environment which discourages tobacco use. We have a tobacco control act which prohibits smoking in a whole lot of public places. We have stipulations where tobacco products, they must have labeling on it, and there is restrictions on marketing and sponsorship of events from tobacco manufacturers. So we have an environment which makes tobacco smoking very difficult or not very fashionable. So therefore, I think that has a major part to play in why the tobacco numbers or the tobacco percentages are the way they are. However, when it comes to alcohol, there has been a noticeable increase in alcohol consumption. And this goes where I talked about tobacco, where the environment does not make tobacco use very fashionable, or tobacco use is pretty difficult. The reverse is true with alcohol. Alcohol, you can say, is pretty much part of the Trinidad and Tobago culture, because alcohol is used and consumed to celebrate many different events, from Christmas to Carnival to weddings to funerals, to birthday, city days, and so forth, and many different events in between. Tobacco, you can say, is pretty much part of the Trinidad and Tobago culture. And because it's part of the culture, it is something which has gained quite a bit of acceptance among many demographics, amongst many age groups. As a matter of fact, according to a 2011 Global School Health Survey, there were some of the participants who admitted to consuming alcohol from as young as the age of 14 years. So therefore, due to exposure of children to alcohol, it will seem to trend that there will be more and more of the population consuming alcohol. And given that in the 2011 STEP survey, you had about 36% of the participants consuming alcohol. You have those students who in 2011 will have been 13, 14, 15. They will be young adults now. And they most likely may have children who, when their time comes, may be exposed to alcohol, and the cycle continues. And the more of that happening, you have more and more of the population being exposed to alcohol. And thus we have the results that we have today. Also, the powers that be have not really constructed a alcohol policy or put an alcohol policy in place to make it more difficult for the population to consume alcohol, or to warn the population of the dangers and risks of using alcohol. That is something which we do not have in place. And I think that also has a part to play into why we have the increase in alcohol consumption seen here in the 2024 STEP survey. Fewer people meeting recommended fruit and vegetable intake. One of the things which we would see in the 2011 STEP survey is that the average household income in Trinidad and Tobago is under $4,000. And I believe that the average salary of somebody of a household in 2024 would not have increased by a whole lot. If anything, the average household income may be between $5,000 and $6,000. However, the cost of living from 2011 to 2024, the cost of living has pretty much gone through the roof during that time. So therefore, the purchasing power of a salary from 2011 has been greatly reduced. And that, combined with the underappreciation on investment and underfunding in agriculture from governments past and present, what this has done is that this has led to a reduction in the amount of fruits and vegetables being produced and being brought to market. So what has had to fill the void was imported fruits and vegetables. As a matter of fact, and we're not just talking about apples and grapes from USA or Canada or foreign countries. We're talking about even here in CARICOM, where we have bananas, which we have the climate to grow, bananas being sourced from countries like Dominica and Grenada and so forth. When you bring in those fruits and vegetables from foreign countries, it is not hard to conceive that the prices of those fruits and vegetables may be more expensive than how they would be if they were grown locally. So it is because of our combination of those factors, which I believe is contributing to the statistics that we are seeing here, where fewer people meeting recommended fruits and vegetables intake. And it's already high, the amount of people who are consuming less than 5 servings of fruits and vegetables. Those are pretty much the main factors why that is so. There's an increase in the number of people diagnosed with high blood pressure. Now, I have discussed this quite a bit in previous videos, but one of the things which I have mentioned in Trinidad and Tobago is that we have a Trini cuisine in which the sodium content of a lot of the foods that we eat, I'm not only just talking about KFC and Royal Castle and pizza and so forth. I'm not talking about just the fast foods. A lot of the Trini dishes that we eat here in Trinidad and Tobago are usually made with quite a bit of sodium. As a matter of fact, if you check this textbook here, the multicultural cuisine of Trinidad and Tobago, if you check this textbook here, the sodium content of one portion of pilau, which is around 420 grams, so it's just under 1 pound of pilau. You could say 1 pound of pilau, the sodium content of 1 pound of pilau is over 1,000 milligrams. And if you check my videos from before, the American Heart Association, they have a recommendation of 1,500 milligrams of sodium for the day, not for 1 million, for the day. The World Health Organization recommendation, they have a less strict sodium recommendation of 2,000 milligrams a day. Even though the tests have not been done, even though it was in the National Strategic Plan for the Prevention and Control of NCDs 2017 to 2021, even though that was one of the action items that was supposed to be done on the population to determine the sodium intake of the population, which will have driven policy, meaningful policy, to address this hypertension epidemic that we have, that has not been done. If we have an idea of what is the sodium intake in Trinidad and Tobago, we can understand what are the foods that are contributing to the high sodium intake in Trinidad and Tobago, and we can take measures to address that. In Barbados, that is what they did. They determined what were the foods which were contributing the most to sodium intake, and they also ascertained what was the average sodium intake of an average Bajan citizen. I had talked about that in a previous video. You can check that video to find out. But one of the things which Barbados did, and what they got correct, was that they know what is the sodium intake, and they know what are the foods that are contributing to the sodium intake, so they can take measures to address that. We have done no such thing, but yet what we want to do is that we want to tell individuals to watch their sodium intake, but yet not address the foods that people are buying every day, and maybe asking the food manufacturers or the food distributors to lower the salt content of the foods, which was done in the UK. In Finland, with regards to sodium consumption, one of the things which Finland did was that they mandated through government legislation that every single package that is sold in Finland, they must have the sodium content on the package, and it must determine whether it's high in salt or low in salt. That is one of the things which they mandated, government legislation. However, I would say that this government has taken a very, very passive approach with regards to addressing this NCD crisis, and I will discuss that in a future video. One of the more surprising things to me was the decrease in the number of people with elevated blood glucose, which is a win for the population of Trinidad and Tobago, because in times past, the diabetes situation which we had in Trinidad and Tobago was very, very dire. So it will seem to that we are trending in the right direction if the data on this survey is actually painting the right picture of the diabetes situation in Trinidad and Tobago. However, this is no time to be resting on our laurels, because one of the things which I have noticed, especially in the hospital setting, is that diabetes taking a very, very heavy toll on people, on individuals, especially in the hospital setting. I have personally seen where, because of high glucose numbers, we talk about numbers like over 200, 300, 400. I've even heard blood glucose readings as high as 550. People who are suffering complications from those high blood glucose numbers. It is something which we still have to address. We may seem to be trending in the right direction, but this is no time to rest. We have to continue with what we're doing in terms of like decreasing the elevated blood glucose levels. And one of the things which I believe which will help to make an even greater impact on our diabetes situation is if we change the food environment so that people can make the healthy choices, the easy choices. So in other words, if the availability of fruits and vegetables can become better, if the affordability of fruits and vegetables can become much better, and then also if we can help businesses, as in food businesses, provide healthier food preparations for the population, food items which are lower in salt, which are lower in fat, which are lower in sugar, and they are less processed than what is usually provided, that will help to make a big dent in our diabetes numbers and will really help to get the population healthier, so that the people who are prone to diabetes will not get it, and the people who have diabetes, they will have a better quality of life than what they will normally have. However, one of the things that we also notice is a noticeable increase in the number of people with high cholesterol, and this is a worrying trend. The reason why is because heart disease is the #1 killer in Trinidad and Tobago, and if we have an increase in the number of people with high cholesterol readings, that means we can have more people in the future being presented to accident and emergency with heart attacks. And it could be possible that the trend that we in Trinidad and Tobago have noticed, or rather the medical community in Trinidad and Tobago have noticed, is that we have younger people being presented to the hospital in clinics with heart attacks. And if this trend continues, where an increase in the percentage of people with high cholesterol readings, we could have an increase in the number of people presented to hospital with heart attacks, and we could see an increase in the number of young people, as in people maybe under 45, and just using that as a benchmark, presented to the hospital with heart attacks or strokes. Another win for the population is that there has been an increase in the duration of physical activity in the population. That is a big win. However, it is my belief that yes, while physical activity is a wonderful thing and it can help to right quite a bit of metabolic wrongs, it is not a foolproof method, or it will not outperform or counteract a bad diet. It is the combination of a good diet, which I believe can only be achieved by a healthy food environment, and physical activity is what will help to bring people to the best state of health that they can achieve. As I said, the population still does not meet the physical activity recommendation of 150 minutes a week, according to the World Health Organization. We have a slightly greater percentage of people with no NCD risk factors, which is a good thing. We have a smaller percentage of people who have 3 or more NCD risk factors, which is a good thing. So that means there are people who are preventing the amount of risk factors from compounding on each other. So therefore, they're taking steps to become healthier, all of which will help to improve the quality of life in the population and help to keep the healthcare costs to a minimum. However, on the flip side, there has been a greater percentage of the population who have 1 to 2 NCD risk factors. So therefore, the things which we need to really look at, in my opinion, is that we really need to change the food environment and stop focusing on personal responsibility, like what the medical professionals in Trinidad and Tobago have done and what the Ministry of Health in Trinidad and Tobago has done. I believe that this is a great travesty, and it is a great injustice to the people of Trinidad and Tobago that this is the position that the Ministry of Health and many in the medical professionals have taken. Because here's the thing, as I've said in the past, the reason why the NCD situation is the way it is not because of the actions of each and every one person. The fact that we have an NCD epidemic that is warranting attention of a whole joint select committee, to me, that indicates that it's not a personal responsibility problem, but it is a food environment problem. As the chief medical officer like to say, yes, there is a whole of government, whole of society approach. But that's where it starts. It's a whole of government approach. And I believe that the government needs to take the bull by the horns and really take a deep dive and really go in hard on actually making the food environment healthier, or to actually advocate into making the food environment healthier. They just cannot be passive and say that is the work of other ministries and leave it as that. No, we really need to advocate to create a healthy food environment. And yes, true, that may involve the Ministry of Trade and Industry, the Ministry of Planning, the Ministry of Finance, whoever it takes. There must be a greater advocacy by the government in order to make the population healthier. Because guess what? One of the things, and I'm going to discuss this in a future video, is that elections have consequences, and your health is no exception. Who we as a population, and that could be a small county, or could be an entire nation, who we put to represent us, to represent our best interests, plays a big part in how healthy we are. Because guess what? If we put people there who are only interested in making their donors to their campaigns happy and not seeking out the best interests of the population, what we will have is that we will have politicians who will serve in the best interest of the donors, and most of the times they tend to be at odds with the needs of the general population. However, if we put in people who seeks the interests of the general population at heart, they will do things in order to ensure that the population that votes them in to serve their interests actually do so. And we have a election coming up in 2025, a general election in 2025. Here's the question that each and every person should ask themselves, what kind of representation are we looking for, especially when it comes to health? Are we going to put in representatives who is just going to keep the status quo of just letting food companies and food manufacturers run roughshod all over us with their marketing and distribution practices and their pricing practices, and just say it's up to the population to see about their own health? Or are we going to put in representatives who is going to look at this NCD epidemic from a holistic approach and say, here what? Yes, people have a responsibility for their own health, but guess what? We as the government, we have a responsibility to our population's health. The people who we represent, the people who voted us in to see about their own needs. And one of the primary needs of every single citizen in Trinidad and Tobago is their health. That's the choice which we in Trinidad and Tobago are going to have to make this year. As Dr. Nagasa said earlier on in the video, what the STEP survey is supposed to do is that the STEP survey is to provide information to the leaders that be in order to drive policy so that health and healthcare becomes better for the population. You have seen the statistics between 2011 and 2024. There's another thing which I must mention. Between 2011 and 2024, there was a national strategic plan for the prevention and control of NCDs 2017 to 2021. One of the drivers of that national strategic plan was the 2011 STEP survey. In my opinion, what has been the outcome from that national strategic plan from that 2011 STEP survey has been pretty much slim to nothing. So therefore, one of the things which I hope this 2024 STEP survey, whenever the final report comes out, I hope that we as the population, we consume it, as in read it, we digest it, understand where we are with regards to health, and understand what are the needs that we have that the government must start driving in order for us, everyone here in Trinidad and Tobago, to become a healthier nation and to become a happier nation. And with that, I thank you for watching. Don't forget to like, share, and subscribe, because by doing so, you help out this channel and its mission of changing the food environment in Trinidad and Tobago for the better, so that we can become a healthier nation, a happier nation, and a nation in which we can achieve our highest potential. With that, I thank you for watching, and I see you soon.